Hi, I'm Robyn Ward, the Acting Executive Dean of the Faculty of Medicine at the University of Queensland, and I'm here with Dr. Stephen Ayre, the new CEO of Metro South. Congratulations on your new job.
Thank you.
That must be an enormous challenge, thinking about stepping into a CEO role.
Yes, it is an enormous challenge, but it's also one that I'm pretty familiar with Metro South, so it should be easy to slip into.
Before we have a chat about the health system, I wondered if you could tell us a little bit about yourself, and particularly where you went to medical school and how you came to be the Chief Executive of Metro South.
Well, I'm a UQ graduate many years ago from the medical school, and so I've had a very checkered career in Queensland and in Tasmania, and came back to Queensland probably about 5 or 6 years ago now, and was originally at Prince Charles Hospital, and then moved over to Princess Alexandra Hospital.
Fantastic. And what was your basic specialty training in medicine? What area of medicine did you practice in?
Well, I practiced in general practice on the Sunshine Coast for many years, and community health. I was involved with the community health service there, and then went back into the hospital system and did my training in medical administration. So I'm a fellow of the College of Medical Administrators. So my specialty now is medical administration.
So can you tell me a little bit about why you chose medical administration and what impact you think a medical administrator can have in a healthcare system today?
Well, I think that was one of the things. I enjoyed general practice very much and dealing with individual patients, but frustrated, I guess, in a bigger picture sense. And that's really why I went back into the hospital system and also did my medical administration training, because you're able to actually influence the health outcomes of a whole group of patients and communities rather than just individuals.
PA is the first digital hospital in the country. Can you tell me a little bit about what it's like working in that environment?
Well, it's a very exciting place to be. Just the changes that I've seen in my medical career, the digital hospital, I think, is really a whole new opportunity, both in patient care, in being able to provide information around patients at a very detailed level, but also the research opportunities that are afforded with the digital record. Now we can select every hospital patient who are currently on insulin, for example, so and look at those patients in real time. What are their blood sugars, etc., all from a single computer. Right.
So that must be very different to your recollection of being a medical student or working in a hospital.
Absolutely. We don't have musty old charts that you have to try and sift through. We can do Google searches on the medical record, so you can look using different search terms to identify patients or the record that you're interested in. I well remember trying to find information in the medical record. Sometimes patients have 10, 20 volumes, and when you're trying to go back and look at that history, it's a real challenge, let alone trying to read the handwriting.
Yeah, that's always been a problem, reading doctors' handwriting.
Absolutely.
So that's one of the big things this is fixed.
Yes.
What would it be like for a medical student working in a digital hospital and having to use medical records that are no longer written?
Well, I think, using the electronic record, because it is a dynamic document that we're using. They're not just scanned documents. So there's a whole decision support infrastructure that assists the clinician in making care decisions. We have over 80 care plans that are automated for most of the common conditions. Order sets are all automated, allergy reminders, etc., when people are prescribing. So I think for the students to actually see the future of healthcare, really to have the digital record access is probably a key in that.
One of the criticisms people make about digital hospitals is that it encourages the mentality around cookbook medicine. How can we avoid that getting in the way of people thinking about what they're doing every day?
Absolutely. Well, we have thought very carefully about that. So we have minimal decision support, but the decision support is at critical components. So it's when somebody is prescribing penicillin for somebody with a penicillin allergy recorded in the system that will alert. So, these are just simple supports to ensure that, some of those very drastic type of interventions don't occur, and the patient doesn't actually have something that they really shouldn't be having.
Right. As a leader of Metro South and the custodian of the first digital hospital, how do you see this is going to be rolled out to other hospitals in Queensland and indeed nationally?
Well, we're very excited about that. PA was the exemplar hospital for the Queensland build of the digital record, and we're rolling that out to our other hospitals within Metro South at Logan, Redlands and QE2 in the next 12 months. And so we will be a fully digital health service. And this will really revolutionise the way patients are cared for in our hospitals, with clinicians at one hospital being able to look at the complete medical record and the observations and all of the other components of the record of patients in our other hospitals. So you can see how that will support some of our smaller hospitals from the tertiary hospital, but also assist in the transfer of patients and the treatment of patients in those hospitals.
Yeah, and I think earlier today we were talking about virtual hospitals, which are, tell me your view of what a virtual hospital would look like.
I think there's very exciting sort of developments. I mean, the digital record does leave us with the possibility to rethink the way that medicine's practiced in hospitals. And nobody likes to be in hospital. People would much prefer to be at home. I think with the digital record and the information systems that are available, we'll be able to do that much more readily for our patients. So patients will be able to go home earlier. Patients may not need to come into hospital except for procedures and other components of care that can't be done in other environments. So I think that is going to be a very exciting time for future healthcare workers as to see how that will develop over their careers, just as it's developed over mine and your career.
Exactly. And research, now you mentioned that earlier on, what power really exists within these digital records to really undertake the research that's going to be game-changing in terms of healthcare outcomes?
Well, I think it is game-changing. We know exactly now how many medications are administered each day at Princess Alexandra Hospital, and that's around 15,000. We know that the medication record is opened around 50,000 times a day. There are around 2.5 million transactions within the medical record each day at the Princess Alexandra Hospital. Extraordinary amounts of data that are available and that can actually feed research. Some of the very simple things that we've already seen in our research capability, particularly around the health service components, is the change in the way that we were looking after diabetics at Princess Alexandra Hospital. So now every diabetic in the hospital, every patient on insulin, we can see by the diabetic nurse can see at her desk. We know that's around 200 to 300 patients every day in Princess Alexandra Hospital are on insulin. We can see there the ones whose blood sugars are low or high. There's a number of things that we can now do, and that opens up a whole spectrum of health services research with the digital record.
So I've really enjoyed the interview today, and particularly hearing about the digital hospital and all that's happening here to transform healthcare. I think it's going to be an enormous advantage for our medical students to be trained in that environment, and they've got a unique opportunity here to really learn how to work in a digital world and even in a virtual world. So thank you very much for sharing that with us today. I've enjoyed the interview, and I really wish you all the best with your job as the CE of Metro South and for an ongoing partnership with UQ.
Thank you, Robyn.